As we advance into an era of unprecedented technological growth, the question of whether humans will be replaced by robots looms large. Innovations in artificial intelligence and robotics are transforming industries, automating tasks once performed by humans, and raising concerns about the future of work and human relevance. This reflection seeks to explore the implications of these advancements, questioning the extent to which robots might replace human roles and considering what this means for our society, economy, and identity. Will robots become our successors, or will they remain tools that augment human capabilities? It's unbelievable, but now I am myself a proof of the advanced technology we have in the world. Well, on the 17th of May 2024 at about 7 am, I was taken to the surgery room for my total gastrectomy, which is the total remove of the stomach. My surgeon, Dr. Enarco Rigali Filho, talked to me before the surgery and he asked me if I had any question, if I was alright, and indeed I was. It's weird to say it, but I had no fear whatsoever. I was feeling very calm and confident that everything would be okay. My only thought at that moment was that I wanted that nightmare to be over, and I was looking forward to waking up back in the room with my mom. When the nurses went to pick me up from the room for the surgery, my mom gave me a nice hug and she cried, saying, "Godspeed, my son." She had been so strong all the time, but when I was leaving the room, she cried. I knew she was terrified, because we all knew it wasn't just a simple surgery. My surgery was a robotic surgery. Basically, the surgeon operated me using the robot called Da Vinci Xi. The doctor's assistants placed the robot over my body, and the doctor was sitting on the other side to control this robot. This modern equipment features the most advanced technologies available in robotic surgery, enabling smaller and more precise incisions. In this type of surgery, the doctor operates through an ergonomic console, reducing strain on the surgeon and ensuring greater precision in the procedures. One of these arms houses a modern camera that allows surgeons to access difficult areas and make more precise incisions even in complex surgeries. This is due to the improved depth perception and crystal clear images provided by the 15 times magnification of 3D and HD images from inside the patient's body. It is capable of carefully removing the skin of a grape and sewing it back with extreme delicacy without damaging it. This modern surgical tool causes less tissue damage, less bleeding, lower risk of infection, less post-operative pain, shorter hospital stays, less trauma to the patient, and a much faster and safer recovery. So, the surgery indeed was successful. However, I had to use a nasogastric tube for 15 days, and I was not allowed to eat or drink anything through my mouth at all. This nasogastric tube would go through my nose, down to my throat, and placed in my intestine. Due to the intubation for the surgery, my throat was already hurt, and with the tubing it got worse. I could feel it hanging in my throat, and I wanted to throw up every time I tried to speak, or if the nurses touched the tube giving my medication. I also had to have an urinary catheter, and I experienced a terrible situation. Because when the doctor allowed it to be removed, we don't know why, but the nurse failed to remove it. The catheter got stuck, and as she had moved it a bit, then I wasn't able to pee anymore through the tube, and they were not able to remove the tube either. Apparently, it was something rare to happen. The nurses were in and out of the room trying to help, and then a doctor came to check it too, and I was there, exposed and in pain. It was very painful. They took me for a tomography exam to figure out what was going on. After that, they took me back to the room, still rolling in pain, with the catheter stuck in there. Then 2 nurses, a guy and a lady, entered the room and tried to remove it again. They kept trying, and thank God it suddenly came out. What a relief. My first shower was given by a nurse. That was awkward. It made me see how life is unpredictable. One day you're out there working, enjoying life, worried about looking good, and the other day you're in a hospital with someone giving you a shower like you were a baby. It just showed me how fragile we humans are. However, we still keep on chasing for the perfect body, money, and superfluous. I stayed in the hospital for 6 days. The day the doctor discharged me was like getting my freedom back, but not totally, as I had to go home with the nasogastric tube and continue the treatment through the tube for more 9 days ahead. Anyway, I was happy to go home. Then, a former student of mine, who I hadn't seen for 5 years, had been talking to my mom and my cousin, and she agreed to pick me up from the hospital to take me home. After 5 years without seeing each other in person, now we would finally meet again. I was taken to her car by a nurse carrying me in a wheelchair. I was looking weak, beard-faced, dry lips, bald, and not able to speak because of the discomfort of the nasogastric tube. I was just able to nod my head as a way to say thank you. But what I didn't know is that right there was not only a person picking me up from the hospital, but someone who would become my angel, my hero.